Welcome, class, to the Interoperable Systems for Best Nursing Practice lecture. I'm speaking on behalf of myself and Dr. Patty Dykes. She was not able to participate in this filming, even though she was involved in the development of the lecture content. Our goal today is to help you understand what is nursing informatics and how it is used in today's clinical information systems, also known as the electronic health record or healthcare information technology systems called HIT, all of which will be used interchangeably in my lecture today. And these systems and how these systems can support your role as practitioners. As you can see from the list of objectives, informatics has many technological issues that I will be discussing, and that will help you understand this specialty, its impact on healthcare and on nursing, including my focus on the need for a standardized coded nursing terminology, namely the clinical care classification system to document patient care. This slide illustrates that the nursing profession has been remiss in harnessing technology. Even though we've advanced our science, developed evidence-based practices, and improved our quality care outcomes. Yet our documentation systems in the EHRs are outdated, in that our nursing notes and nursing practices are still represented as free text instead of as a structured nursing language. Today's patients are sicker, living longer, and have multiple chronic illnesses requiring more complex care. Also, today's federal regulators are mandating that payment for health care be value-based. That is, payment is based on the cost of providing the quality, safety, and patient care outcome measures. Also, they are requiring that these outcome measures be interoperable so they can be electronically transmitted to other healthcare facilities. But before we continue, it is important that we review just what is informatics. I like to begin with the computer, which was considered a number crunching machine that could only add and subtract. However, as the computer advanced, it also became a data crunching machine or tool that could not only add and subtract, but also process healthcare data. This tool was called informatics and coined by the Russians and the French. And in the United States, the nurses and physicians accepted the concept and gave it different definitions. I like the original nursing definition by the American Nurses Association the best because I can understand it. They essentially define information as the integration of computer science, which is the electronic hardware, with information science, which is the software used to process the nursing data, which represents the nursing science into output information. Nursing informatics has also been explained by Nelson in this illustration as the processing and communicating of data into information, knowledge, and ultimately wisdom. The model depicts this process and can be used to represent informatics by any of the healthcare specialties or any healthcare discipline. This model should help you understand that data is the foundation of informatics, even though it's getting harder and harder to understand because of today's sophisticated electronics, such as the iPhones and the iPads, that do not reflect how data is transformed electronically into information. In other words, data, which represents a single fact or concept, has to be coded using a standardized terminology or language for input into the computer so that it can be translated into machine language consisting of combinations of zeros and ones. that are then stored and processed by computer software instructions, which is also programmed to generate the data as output information. As I stated, the coded data is not free text, but it's structured in a terminology based on certain rules or criteria described by Cimino's article, which he published in 1989, entitled Desiderata, in which he describes his 12 major desired data criteria for the ideal structure of a terminology used for processing data, and by which may help you understand what data is. For example, he indicated that each data element should represent only one atomic level fact, which has to be a unique identifier or code, and which has a unique definition, and that code can never be used for any other concept, and if changed, must be sent to what is called the data cemetery. My best example of an atomic level fact that you can relate to is your name. Many would consider your name to be one fact when it is really represents three facts: first name, middle name, and last name. By coding them as separate facts instead of one, you could process and sort them with last name first, middle name first, and etc. The Cimino article is well worth reviewing and something you should use as part of your readings. An example of another coded terminology that is being used in healthcare is the International Classification of Diseases, commonly known as ICD. Now, for your information, ICD was initiated in 1850 by the World Health Organization to classify the world's cause of death statistics. But it wasn't until the 1960s, with the passage of the Medicare and Medicaid legislation, that our federal government got involved in adapting the ICDs so they could determine how their service could be classified, coded, and paid. Initially, the feds used the 9th revision of ICD, diagnoses and procedure codes, which were later collapsed into DRGs for payment of hospital services to the Medicare and Medicaid patients. The government also used the CPT codes developed by the AMA for payment of surgical procedures, treatments, and other practitioner services performed outside the hospital, that is, in the outpatient departments, the clinics, or physician offices. To continue, it was not until the early 2000s that the federal government started to become involved in computer technology. Both President Bush and Obama advocated that technology should be used in hospitals for electronic payment of Medicare and Medicaid service. This interest led to the formation in 2004 of a new HHS department called the Office of the National Coordinator of Healthcare Information Technology, called ONC, which still exists and was established to recommend healthcare technology applications for the Centers for Medicare and Medicaid Services, known as CMS, to implement as federal legislative regulations. Initially, the ONC created a Healthcare Information Systems Planning Board called HISB to evaluate and recommend code sets for the payment of the CMS services. It was during this era, 2005 to 2009, that the HISB board recommended and the Secretary of HHS approved that the clinical care classification was approved as the first coded nursing terminology standard for for the electronic health record, and it was considered interoperable. We had really achieved that steps, and we're so proud of it. However, with the passage of the HITECH Act of 2009, that was part of the American Recovery and Reinvestment Act, the ONC dropped the HISB board and initiated a new program called Meaningful Use, which focused primarily on the reimbursement of hospital department services that were revenue generating and which already had code sets that could be used for electronic transmission. And since the nursing departments and hospitals were not revenue generating, and since nursing care costs are still in the room rate, their services were not included in the meaningful use legislation, and the CCC system and nursing was dropped. The meaningful legislation is also important because at the end of the phase 1 year, a hospital received a large sum of federal funds, especially to upgrade and implement an EHR in their hospital. And as a result, today, most hospitals in the country are computerized and use online transmission of financial transactions. With the change in administration and with complaints that the meaningful use regulations consumed excessive time, and it wasn't amended with the passage of another legislative act called the Medicare Access and Chip Reauthorization Act of 2015, known as MACRA, M-A-C-R-A, and which initiated a new method of payment for Medicare and Medicaid services, and which will slowly be implemented by 2020. These services will also impact on your practice in the future. The MACRA legislation has changed the payment for CMS services from meaningful use reimbursement to value-based quality care. That is, the practitioner services are based on the value or the cost of providing measurable quality outcomes for an episode of illness, and should have great implications for practitioners and for the nursing profession. Let me recap what I have highlighted. That is, all started with the computer, and as it advanced and integrated into healthcare industry to process healthcare data into information, it became known as informatics. And that informatics requires standardized coded terminology to process the data into information and represents the cornerstone of this specialty. Furthermore, the healthcare industry used computer technology primarily as payment for the inpatient services to Medicare and Medicaid patients, using terminologies like ICD and CPT and strategies like HISB, code sets, meaningful use stages, and now MACRA, which is today's new federal health care value-based payment system. These milestones should help you understand why we need to go the next step and include the CCC nursing terminology into the EHRs to document terminologies that will provide value-based measures for patient care.